The seventh cranial nerve is the facial nerve. The facial nerve transmits motor informations to the muscles of facial expression as well as the stapedius muscle, which is involved in regulation of hearing, particularly of loud noises. The facial nerve, as well as the motor component, has a sensory component responsible for taste from the anterior 2/3 of the tongue. As well as this, there is a parasympathetic component that is predominantly secretomotor to the lacrimal, submandibular and sublingual salivary glands. To assess the sensory function of the facial nerve, ask the patient if they've noticed any changes in their sense of taste. The facial nerve receives taste sensation from the anterior 2/3 of the tongue via the chordae tympani. Taste sensation is then sent to the gustatory portion of the solitary nucleus. Motor assessment. There are various branches. The facial nerve divides into 5 key branches in the region of the parotid gland, the temporal, zygomatic, buccal, mandibular and cervical branches. Each of these branches innervate specific muscles involved in facial expression. The temporal branches innervate the frontalis, orbicularis oculi and the corrugator muscle. The zygomatic branches innervate the zygomatis major, minor, as well as the levator labii superioris. The buccal branches innervate the buccinator and orbicularis oris muscle, whereas the mandibular branches innervate the mentalis, depressor labii inferioris, and the cervical branches innervate the platysma. In order to examine the motor component of the facial nerve, ask whether the patient has noted any changes of hearing to loud noises. Paralysis of the stapedius muscle can result in hyperacusis, uncomfortable sensation of very loud noises. In terms of inspecting the muscles of facial expression, you can inspect the patient's face at rest for asymmetry. Ask the patient to raise their eyebrows, assessing the frontalis, or scrunch up their eyebrows, assessing the corrugator muscles. You can ask them to close their eyes tightly to assess the orbiculari oculi muscles. Ask them to puff out and blow out their cheeks. Ask them to smile, assessing the levator anguli oris and zygomatic major muscles. And ask them to purse their lips as if they're trying to whistle to access the orbicularis oris and buccinator muscles. Let's have a look at this case. This gentleman has a loss of facial nerve innervation on the right hand side, and that's why you can see a loss of motor activity and loss of muscle activity and tone. So on inspection, the patient face appears asymmetrical. There is weakness in the muscles of the face on the right side. When you ask the patient to perform maneuvers, the patient will be unable to screw their eyes tightly shut or open their mouth on the right side. They will have a loss of facial expression, unable to wrinkle on the left-hand side of the forehead, and the eyelid on the right will close very slightly after the left-hand side. The patient may also report altered taste on the anterior 2/3 of the tongue, or in general altered taste, and may also complain of hyperacusis on the affected side. It's important, if you determine a facial nerve palsy, to assess the external auditory meatus, looking for any signs of vesicles which may indicate Ramsay-Hunt syndrome. This is where the herpes zoster virus attacks the seventh cranial nerve. I would also want to assess the patient for hyperacusis and test for any signs that could damage the nerve, such as blood sugar testing for diabetes, as well as inspecting and organising image of the parotid gland in case there is compression at that region. Common causes of seventh nerve palsy include Bell's palsy, herpes zoster virus, cerebellopontine angle tumours and parotid tumours. The key question is whether you're able to clinically distinguish upper and lower motor neuron palsies. Upper motor neuron seventh nerve disease would result in sparing of the forehead, so the patient will be able to wrinkle their forehead on both sides, and that's because there's bilateral cortical innervation to the forehead. Whereas in lower motor neuron conditions, the patient's forehead will not be spared, they will not be able to wrinkle their forehead. Bell's palsy is treated with high-dose steroids in a timely fashion, acyclovir if the etiology is viral for Ramsay-Hunt syndrome, and the eyelid is protected and the eye is lubricated. So in summary, the seventh nerve or the facial nerve asks the patient if they've noticed any change in their sense of taste, any signs of altered hearing, particularly hyperacusis with loud noises, inspect the face for any asymmetry at rest, and examine the facial movements by asking them to perform various facial expressions and ensure to examine the external auditory meatus. Thank you for attending this medicine masterclass.